Good morning. I'm Peg Kerr. I'm the department head of nursing here at UD, and on behalf of the University of Dubuque, the nursing faculty and myself, I am delighted to welcome you to the pinning ceremony for the UD Nursing BSN class of 2014. Before we proceed into the program, I'd like to acknowledge the presence of some distinguished guests, Dr. Bullock, president of the university, and his wife Dana, Dr. Mark Ward, Vice President for Academic Affairs, and Dr. Gail Hodge, Associate Dean of the College. Thank you so much for being with us today. Your support means so much, not just today, but all year long. Thank you. I'd also like to thank the folks who worked so hard to help us put this event on. University Relations, Sherry, Rosemary, thank you so much. Food service staff who do the beautiful tables for the reception following, and also the maintenance crew who do all the setup and tear down. We really appreciate it. Also, each year I have the privilege of inviting students from the junior class to serve as ushers for our pinning ceremony. These are students who we feel are deserving of special recognition. And this year our ushers are Miss Jennifer Martinez, over there on that side, Jen, and Miss Rosalind Borman over here. So let's give them a hand. The pinning ceremony is an important event because it represents a conclusion to 4 very intense and rigorous years of study. The stakes are high and the path can be rough, but I can assure you it'll be worth it. I've told you that many times. Madeline Misko, a nurse who's also a published poet, refers to nurses as having a privileged and precarious access to the human experience. Those are profound words, and I believe she captured the essence of nursing in them. It is truly a profession like no other, and it gives me great pleasure to welcome you to it on this day. The tradition of the pinning ceremony has been around for many years, and it signifies your official initiation into the brotherhood and sisterhood of nurses. I retell the story of the history of pinning each year because I think it's important to put what we're doing and what's happening here today into context for you. The nursing pin is a 1,000-year-old symbol of service to others. The earliest ancestor of the pin dates back to the Maltese cross, adopted by crusaders and worn on their religious habits as a symbol of service to Christianity. Today, modern programs of nursing education still bestow a pin upon their graduates, and it's a symbol which represents their school and identifies them as a graduate of a particular program. Every school's pin is distinctive, no two are alike, and it's worn only by graduates of that program. When you receive your pins today, you'll notice that yours too has a Maltese cross in the center. And the other thing is the pin is also a replica of the school seal. You'll see it at the top of your programs. The center of your pin has the official light of knowledge in the center. We carry on this very old and beloved tradition of pinning, and while nurses no longer wear caps and many don't even wear white uniforms anymore, graduated nurses still proudly wear their pins. It will be a treasured symbol of your association and everlasting bond with your nursing school, evidence of completing UD's rigorous and physically demanding course of study, and remind you always of the rich heritage and history of your profession. Being pinned is a ritual which will bind you to generation upon generation of nurses who came before you. Pinning is a bridge from nursing's past to nursing's future. I hope you will remember the pride and exhilaration you feel today, each and every time you pin this symbol to your uniforms. The faculty and I would like to be the very first to offer our congratulations to the class of 2014. To the friends, family, and loved ones in the audience, we want to acknowledge you for the sacrifices that you have made and the considerable support that you've provided your graduate as they have gone through the program. We know they've needed it. We'll move on to the program now. Reverend Dr. Jeffrey Bullock, our college president, would you please do the honors of an official welcome for us?
Thank you. I don't know how to do an official welcome, but I'll fake it. And so how many of you were here last year? Let me show of hands. Some of you. Raise them high so I'm getting old here. 1, 2, 3, 4. Okay, do you notice anything different behind me? There's no garage. Don't you remember that symbol of kind of neighborly love, or I don't think decrepitness is a word, but it's a symbol, it's a metaphor for what you nurses will be doing for all of us. So it's gone, and hopefully we won't be very soon. It's wonderful to be able to have a short part in this service. And I was thinking as I was sitting here with my wife, Dana, yesterday we were facing the other direction for the commissioning of our ROTC students. Today we're facing this way for the pinning of our nursing students. And as I was sitting here, I was thinking, why are both of those services so meaningful and so emotional? And I think I finally concluded that the reason for that is because at their core, both vocations are about service to others in some very profound and deep ways. And I think what I would want to say to you, graduates, that you represent, I think, the very best in what we hope our graduates do for the rest of the world. Our motto is Mancherlei Gaben und ein Geist. And did anybody tell you that's a requirement for graduation? You have to be able to, can you translate that? Mancherlei Gaben und ein Geist is various gifts but one no, I don't know. Various gifts but one spirit, all serving the church and the world. And the key word there is service. And this is a tremendously rigorous program. I'm quite confident that I wouldn't make it through it. I can't speak for Dean Ward or Dean Hodge, but we're very proud of you. We're grateful for your families, for the support that they have provided. We're grateful that you chose us to be this place where you would learn this vocation. And I would encourage you to go out and serve with energy, intelligence, imagination, conviction, and above all else, love. So thank you for all that you do. We're proud of you. You're going to do good work, and I'm sure I'll be seeing one of you sometime in the future. So thank you.
Thank you, Dr. Bullock. And now it is with great pleasure that I introduce the speaker for this year's pinning address. Reverend Dr. Barbara Reed was one of our faculty here up until this winter when she left for another position. I'll talk about that. But anyway, she graduated from nursing school at Cypress College in California in 1975. She has a BA in social sciences and history and a master's in nursing from the University of Washington in Seattle. She also has a doctorate of worship studies from Robert E. Weber Institute for Worship Studies, which she received in 2008. She's practiced nursing on inpatient adult and pediatrics units, pediatric home health. She's a manager on the West Coast for Gentiva Health Services. She was on the quality management team there as well. She was nursing director at Health Corps, part of Cisco Insurance for 2 years. She participated in the successful accreditation of case management and utilization review services there. She was a nursing professor at Clark University for 5 years before she joined us. Here she was the assistant department head for 5.5 years. She was also ordained to the ministry in 2008. That came in very handy in her role as a nursing faculty member here. While here, she was frequently a speaker in the University of Dubuque chapel services. She led a special workshop for our nursing students each year on spiritual care of patients for nursing. And she also is a frequent preacher for churches around the tri-state area on Sundays. She left us to become the Director of Spiritual Services at Judson Park Retirement Community in Des Moines, Washington. And she's been there since February 26th this year. She received a calling, and that's where she went. She provides pastoral care and chaplain services for staff and 300 residents living in their apartments, assisted living, memory care for Alzheimer's patients, and it's also a skilled nursing home. In her first 3 months, she visited innumerable times with residents, led 4 memorial services and facilitated others, provided relationship counseling, made hospital visits. She teaches 4 classes a week. Are you sure you don't want to come back with us, Marla? She's a member of the senior leadership team and is on the advisory committee of senior services for the city of Des Moines, Washington. She also happens to be married to Robert Reed, who is the department head chair of the communications department here at UD and also runs the master's program in communication here. He's retiring this year. We just had a ceremony for him yesterday. They have a daughter, Laura, who lives in Kirkland, Washington. So, Barbara, what more can I say?
I know all these people on the front row. All females this year, too. Oh. I've always liked it when we had male graduates, because when there are men around, the women behave better. So, having been a manager for 15 years along the way and having to deal with women who, she hurt my feelings. Men don't do that, okay? So, anyway. Today's a special time for you as nursing graduates. No more care plans, no more papers, less reading of hardback books and so on. And for your family and friends who have gathered to celebrate with you, it is an exciting day. And for nursing faculty and preceptors, we get to kick you out of here. Okay. You have worked hard to arrive at this day, and for I think most of you, somewhere along the line, you realized it was harder than you thought it was going to be, right? Yes, we had moments of wondering, oh, I didn't think it was going to be that hard. So you should be proud of what you have accomplished. You should be proud of the obstacles that you have gotten over, under, and around. Some of them you've knocked over to get to this goal. And family and friends, you should be proud of these women. They have worked hard. They have taken what you as parents and friends have built into them, and they're starting a career on that foundation. Nursing faculty, you should be proud of the work you have done. This is a moment to savor. And yet, it is only a moment. And after this moment will become many more moments. Tomorrow brings the moment when you walk across that stage and receive your diploma from the University of Dubuque. And then there are going to be those long, vigorous moments of preparing to pass NCLEX first time. Right? Okay. And then there is that moment when your NCLEX computer shuts off during the test and your exam is over and you don't know yet whether you passed. It's a moment you don't forget. And then there is that moment when you receive your first license in the mail with those hallowed words, registered nurse, on there. And then that moment you step into that first job on your first day as a nurse. Moments all through your career. All moments, both exciting and terrifying. moments you will never forget. And yet there are even more moments ahead of you as you serve your patients or your clients or your residents with the nursing skills and the critical thinking ability you have gained here and the hearts of service and caring that you have cultivated your whole lives. So many moments that you have the privilege of being totally present in the moment with your patients and making a difference in another person's lives. Making a difference in the health of your community because you work together with other nurses and healthcare professionals. Some of you will be involved in making a difference in the laws that govern our healthcare in our nation and that govern the practice of the nursing profession. And some of you will stretch out and affect the health globally, making a difference to people in other places. Moments of difference that may take minutes or hours or months or years to achieve. You'll only make those differences because you choose not just nursing, but nursing excellence. Now, Merriam-Webster Dictionary defines excellence as extremely high quality. Notice that it doesn't say perfection, because Merriam-Webster defines perfection differently. Here's what it says about perfection: freedom from fault or defect, flawlessness, the quality or state of being saintly, an exemplification of supreme excellence, an unsurpassable degree of accuracy or excellence. That's perfection. That's not what we're aiming for. In fact, as far as I understand, there's only been one perfect human being in this world, the God-man, Jesus Christ. So don't hold yourselves to being perfect nurses. You will only fail at it. Perfectionists also tend to be hard on themselves and make the rest of us miserable. Don't. Perfectionists tend to find it difficult to learn from mistakes because there's this little inner voice telling them, you should have already known that. You should have been better at that. That wasn't as good as you can do. You're never satisfied. It takes humility to be human enough to learn rather than try to be perfect. I will always remember a medication error I made as a nurse. I was working at Marybridge Children's Hospital in Tacoma, Washington, and I had given one of my patients what I thought was the correct dose of an antibiotic. After all, it had come already filled in the syringe, filled by a pharmacist who's supposed to know what they're doing, and I had read the label quickly, and it looked right. And if I had turned the syringe a little further, I believe I would have recognized the error. But I didn't. And I gave that child 100 times the ordered dose of that medication, enough to kill the child. The child was airlifted to Seattle Children's Hospital and did fine. Never even had a bad outcome of any kind. But I wasn't fine. I actually went to the hospital, opened up the sharps container, which is a real no-no, of course, and got that syringe so I could see with my own eyes. I couldn't believe I could make such a mistake, but I did. And I turned in my resignation when I found that syringe because I could not handle being human enough to make a mistake that could kill someone. Thankfully, my boss refused to receive my resignation and helped me look at being a nurse with wiser eyes, going for nursing excellence, not perfection. So aim for nursing excellence, extremely high quality nursing. Excellence in nursing practices that practices a task until you are excellent at it. Don't be sloppy and don't assume everything's going to come easy. It's not. Aim for excellence that checks and double checks for safety. Excellence that listens to that little red flag that goes off as you gain experience, that says something's wrong with this patient and you don't even know what it is. You take action anyway and get help for the patient. Excellence that drives you to subscribe to nursing journals and read them even, so that you never stop learning. Excellence that causes you to volunteer to be a part of a quality improvement team rather than staying on the sidelines. Excellence that cares for the whole person, not just their bodies, because their spirits need your care too. Excellence that never says, "That's not my job," or "That's beneath me. I'm a nurse." And then something important to me, nursing excellence that drives you to be nurses who refuse to be or accept bullying. Nurses who bully other people. You know, I've told you more than once, please be the generation that will wipe out what they say about nurses, that we eat our young. Be the generation that can never be said about. Aiming for nursing excellence instead of perfection also allows us to laugh at humorous situations, even when the laughter is at our expense. Being human enough to laugh at ourselves is healthy and healing. And let's face it, we humans are pretty funny when we're not even trying. And we can choose to be embarrassed, or we can choose to laugh. Everybody else is laughing, and we can choose to join them. I had one of those embarrassing moments that I chose to laugh. I didn't feel like I could do anything else recently. As a chaplain, I lead a class every week with residents in our long-term care facility, and it's a lot of fun. We sing old hymns that are familiar, we reminisce about their memories, we discuss our chosen topic, and we learn from Scripture every week. And almost every week, someone in my class says something very deep. They're struggling with questions about life and death. They're struggling with what meaning there is when their body declines and their minds are going. And last week, during the closing hymn, an old favorite called "What a Friend We Have in Jesus," I knelt down on one knee to get the attention of this one resident who tends to fall asleep really easily. But if I get down and I wake her up a little bit, she gives me this huge smile, and she'll just start singing wherever we are because she knows these songs. And so I got down on my knee to engage her again. Got my smile, started her singing, and I tried to stand back up again. And I couldn't. And I like to chalk it up to the fact that I've started on a medication for vertigo in the last 2 weeks instead of my age. But whatever it was, I could not get up. And as the activities director was helping me to my feet, heaven forbid we were singing the phrase, "Jesus knows our every weakness." I mean, we all just cracked up, I must admit. That was pretty funny. So choose the healthy response. Leave the facade, because that's all it is, ladies. Leave the facade of perfection behind and laugh loud and long, because the rest of us are going to be laughing. Join us, okay? And finally, for nursing excellence, every moment, character matters. I was in my second nursing job in an orthopedic hospital near Pasadena, California. And one evening we were having trouble with an elderly female patient who was recovering from a broken hip. She was crabby. She fought everything we did. She didn't want to be turned. She didn't want to get up. She didn't want to eat. The food was lousy. Nothing we did was right. She was on her call light all night. It was a tough night with her. And during one of those quiet moments toward the end of the shift, as the nurses were sitting at the desk doing our charting, back when we used to write it down, we were doing something we should not have been doing. We were complaining about this woman. And a young physician, a gerontologist who specializes in the care of the elderly, was sitting there charting on a resident, a patient, and he was listening to us young nurses complain about this woman. And at one point, he stopped us and said words I have never forgotten. You are what you have been becoming. Let that sink in. You are what you have been becoming. If you don't want to be like that woman when you get to be her age, don't be on the way now. We are what we have been becoming. Sometimes we think that the small decisions that we make every day are insignificant in the big scheme of life, and they don't reflect who we really are. We tell ourselves that some of our decisions that reflect poor integrity are a lapse of our real selves. We may take home a few office supplies without permission, but we would never steal drugs. Cheating on a quiz or a paper is no big deal. After all, it's just a quiz or a paper. Question is, then what about if you made a medication error or you forgot to do something? Are you going to have the integrity to tell the truth then? After all, if our integrity is poor when the stakes are low, why would we be any different when the stakes are so much higher? When we're afraid we could lose our jobs. But if the physician was right, and I believe he was, that we are what we have been becoming, then each choice we make is part of what we are becoming, the kind of person we're on our way to being. Jesus said it like this in the Gospel of Luke. Whoever can be trusted with very little can be trusted with much, and whoever is dishonest with very little will be dishonest with much. It sounds like what that doctor said, doesn't it? We are what we have been becoming. So make sure the character you show in the decisions you make are something you can be proud of becoming more of through the rest of your life. If the dishonest decision you are about to make isn't one you want to be known for, don't do it. In the big moments, in the small moments, character matters. Your character matters. Nursing excellence counts and depends on character. So I'm excited to share your big moment of receiving your nursing pin. Now live out what that pin stands for in all the moments you have coming. Live it out with excellence, not perfection, with a humility that lets you laugh at yourself, and live it out with character and integrity. And may God bless all your moments to come.
Thank you, Barb. Dr. Neil McNaughton and Professor Beth Nyan will be doing the preceptor recognition for us today.
Good morning, and thank you, Barb. That was an excellent speech. I really appreciated it. And do remember that it's not perfection, it's excellence. With that, understand that the nursing faculty acknowledges that we do not prepare nursing students to become nurses of excellence without help. The preparation of excellent nurses requires a team effort. This team includes the university faculty who teach prerequisites, general education and science courses, along with the nursing faculty. This team also includes our clinical partners, the healthcare organizations which allow our students to practice their skills and knowledge with the guidance of the nursing faculty, along with the experienced professional nurses who are committed to mentoring, nurturing students and new nurses. Today, we'd like to particularly acknowledge those nurses who serve as preceptors to our students in their final semester of nursing. What's a preceptor do? Or who are they? Preceptors are experienced staff nurses who patiently take their time to share their knowledge, wisdom, and experience with our students, despite the fact that often it would be just easier and faster to do things themselves. Preceptors take nursing students under their wings to provide opportunities, and sometimes they push the students to move the student from that role of the student to that of embracing the role of the beginning professional nurse. This does involve significant time and energy. The medical surgical portion or preceptorship involves 144 hours of student preceptor time, working the preceptor's hours while learning to provide care for multiple patients. The rural preceptorship involves 36 hours of student preceptor time in a small rural hospital, and we use either Guttenberg or Dyersville hospitals for that, where they've experienced the importance of being a generalist, providing care for medical surgical patients while working and coordinating care in the operating room, the emergency room, and in some instances, the delivery room. The preceptorship is an important transition for our students, the beginning of the movement from a student position to beginning of their professional practice, gaining independence, increasing their critical thinking, along with progressively increasing their responsibility. Each preceptor will receive a preceptor appreciation certificate and tickets to an event at the upcoming season at the Heritage Center as a token of our appreciation. Their certificate reads, "This certificate of appreciation is awarded for serving as a preceptor to senior nursing students. Service as a preceptor is essential to the development of critical thinking and clinical nursing skills in the final semester of the University of Dubuque BSN program." The University of Dubuque nursing program faculty recognize the time and energy that service as a preceptor entails, and are thankful to our preceptors for their service to their patients, nursing education, and to the nursing profession. We would like to thank the following preceptors who are here. We ask that they come up when their name is called to receive their certificate. The first person I'd like to acknowledge is Janet Clement, and Janet is from the Mercy Hospital over in Dyersville. Next, I have Jeannie Duggan, and she's from Mercy Hospital here in Dubuque. And is Sherry here? No. Or Polly? No. Oh, Sherry is. There she is. Okay. Hi, this is Sherry McSwain, and Sherry is from the University of Iowa Hospitals and Clinics in Iowa City. Kelly Obadal. Kelly is from the University of Iowa Hospitals and Clinics also, and Kelly is one of our graduates. Is Courtney here? No. Susan Rudin. Susan Rudin is from Mercy Hospital, or Mercy Medical Center here in Dubuque also. Are there any other preceptors here that I have not called? I don't want to miss any of you. Okay, good. Well, many of them are unable to attend this program due to either previous commitments or their work schedules. Their certificates are forwarded on to their chief nursing officers. I want to elaborate also in that many of our preceptors take more than one student. They will have one student in the first part of the semester, and then they will have a student in the last part of the semester. From Genesis Medical Center, we had 2 nurses serve as preceptors. From Guttenberg Medical Center, we had 7. From Mercy Medical Center in Dubuque, we had 8. From Unity Point Finley Hospital here in Dubuque, we had 5. And from the University of Iowa Hospitals and Clinics, we had 6 who served as preceptors. Thank you to all of those who were able to, thank you to them who are here and to all of those who are unable to join us for their great work with this outstanding class. Thank you.
I'll add my thank you as well. Next on the program is the Looking Back presentation. This year, the speaker who has been honored by her classmates by being selected by them to give the address is Ms. Courtney Fisk.
Good morning, everyone. On behalf of the UD Nursing Class of 2014, we would like to thank all family, friends, preceptors, and faculty for being here today and sharing this special day with us. Kind of right in the sun, getting a tan right now. So as we look back over the last few years, especially the last 2 in the nursing program, there's not really words to describe our appreciation to those who have dealt and put up with us during this journey, or what we like to call our suffering. There were days that we would probably call and talk and laugh about Dr. McNaughton, walking in a kilt to class. That was extremely unexpected. But there were probably far more times where we called to cry or to scream or to rant or possibly tell you that we ate $20 worth of McDonald's and devoured a carton of ice cream after a med surg or a patho exam, which I think we can all agree that no matter how hard or how much we studied, whatever we did study might not have been on the exam. So as we look back over the last 2 years, I realized that the people we should have probably thanked a little bit more were each other. It's hard to imagine a closer knit, cold pack of weirdos than this class. But we came together like sisters, and we fought and we pity partied our way through this thing they call nursing school, and I think we did a great job, girls. I'm happy to say that we're professionals at wet to dry dressings. We are free American citizens. Thank you, Brittany. And I am not ashamed to say that as a class we averaged roughly 2 showers per week. Sammy kind of brought down the average. So nursing school led us to believe that the highlight of our days included 5-hour-long classes, ATIs, the renal system, and Professor Craig Brink's candy bowl. So, thank you. But nursing schools also allowed us to, make some great discoveries as well. For example, the Guttenberg Motel is probably one of America's scariest places. That Carmelitas have 3 sticks of butter and 64 caramels in just one batch. That Dr. McNaughton's favorite word is relax. And that if you came to class in jeans, you were violating the dress code of yoga or sweats. So, looking back, I don't think any of us could have imagined this day ever getting here. We've experienced a lot together. We've been through marriages and breakups, engagements and bursts, and now our future lies ahead. So we would not be where we are today without faculty support, and I don't know how they do it and put up with us, but our class is extremely thankful for all that they have done along the way. Your words of wisdom and knowledge have shaped all of us into becoming qualified and skilled registered nurses, so thank you very much. But ladies, we've done it, we're here. I never thought this day would come, and we've made it a long way since 2010. I am so happy and so proud to say that we finally did it, so congratulations, and I love all of you guys.
Suffering. It wasn't so bad. Okay. The next thing on the program is the vision for the future. Ms. Samantha Miners is the president of the University of Dubuque Student Nurse Association, and in that capacity, She will be speaking today on the class of 2014's vision for the future. Sammy?
A lot of people here. Holy cow. Hello, family, friends, faculty, preceptors of the class of 2014. If you don't know me, my name is Sammy Miners, and I have had the privilege to serve as the University of Dubuque Student Nurse Association president this past year. It's a mouthful. To assist my fellow classmates in understanding what it feels like to be up here right now, I'm currently having tachycardia, tachypnea, diaphoresis, and potentially may have thrown a few PVCs. For the audience, this simply means I have a rapid heart rate, rapid respirations, and I am profusely sweating. Typically, people tell you to picture the audience in their underwear. Well, I was told to picture the audience in hospital gowns with the back open. So, thank you. It helps. It helps. There are very few people who will stand up here as we do and get this pin put on our dress to signify our great accomplishments of nursing school. This ceremony has been going on since the 1860s, thanks to our beloved Florence Nightingale. I would cite my source, APA style, but I just looked it up on Wikipedia. This pin signifies our devotion to those patients that trust us enough to put their lives in our hands. It also signifies the great responsibility we are about to take on as nurses. The responsibility to keep our patients breathing and keep them safe. Remember that for NCLEX. One may call us superheroes, and some of our future patients may truly believe that we have superpowers. People will now look to us for answers of why they are feeling the way they are feeling. We are advice givers, medical interpreters, a voice of guidance, and a trusting friend. Most patients believe that we are capable of taking away pain with the snap of our fingers, but really we just have PRN meds. Not only will our patients be describing their newest symptoms to us, but also our family and friends. They will be coming to us with every little ache, pain, or injury because we are now nurses. But really, we just want to diagnose them as TMI, or too much information. Over the past 2 years, we have spent countless hours reading, studying, eating, enhancing our skills, and basically anything but sleeping. We all have been looking forward to the light at the end of the tunnel, and here it is. Instead of wearing our lovely white scrub tops with the patches on the sleeve and those navy blue pants that just happened to rip a few too many times for some people, we'll be wearing comfortable scrubs day in and day out. Ralph Emerson once said, "What lies behind us and what lies before us are small matters to what lies within us." We, as nurses, will reach into the hearts and minds of the sick and give them hope and love. This alone will promote the best healing. We all knew in our hearts that we wanted to become nurses. We took that dream and made it a goal, and today that becomes a reality. Congratulations, class of 2014. We did it.
On behalf of the class of 2014, we would like to offer this gift as a token to our gratitude. I think that's correct. I frequently have Stephanieisms. It is our hope that the classes before us will be just as successful and well caffeinated.
Does that mean I don't have to open it?
Yeah.
Good, because I'm not good at that. Thank you very much. It's an impressive group, isn't it? Yeah, we're very proud of them. Now we're at the pinning part, which is what we're all here for. Professor DeMoss? Dr. McNaughton?
You guys ready? So as I call out the names, if the student will come forward and the person that's going to pin them as well, okay? So we'll start off with Rachel Bartz. Rachel's father, Jeff Bartz, will be pinning her. Rachel's area of nursing interests are the OB, ER, and critical care. Her future plans are to become a family nurse practitioner, and she would like to thank her wonderful family, especially her loving father and her husband, for their continued support. Also to her mother for teaching her to follow her dreams. Congratulations, Rachel. Sarah Crivello. Andrew Abel will be pinning Sarah. Sarah's areas of interest are ER or the OB. Her future plans are to work in either the emergency department or in labor and delivery. She hopes to continue her education and one day become a nurse educator. She would like to thank her family and friends for their support, Andrew for keeping her confidence grounded, and her professors and preceptor for their knowledge, support, and patience. Jennifer Fisher. Jennifer's dad, Rich Fisher, will be pinning her. Jennifer's areas of interest are pediatrics. Her future plans include going to the University of Wisconsin Hospitals, where she was recently awarded a competitive internship in the neurosciences. Jennifer would like to thank her mom, dad, sisters Jordan, Jamie, and Julia for believing in her, and in her boyfriend Michael for helping her to believe in herself. Congratulations, Jennifer. Courtney Fisk. Courtney's mother, Sue Fisk, will be pinning her. Courtney's areas of interest are OB and women's health. Her future plans are to work at Swedish American Hospital in OB delivery, where she recently accepted a position. She will also be starting grad school in the fall at the University of Illinois at Chicago College of Nursing in the Women's Health Doctorate of Nursing Practice program. Courtney would like to thank her family and friends, especially her parents, for their love and support. Also a special thanks to Chelsea Vormazil for being an amazing friend for the last 4 years. Congratulations, Courtney. Stephanie Hendrich. Stephanie's father, Jeff Hendricks, will be pinning her. Stephanie's area of interest is oncology nursing. Her future plans are to begin work as an oncology nurse at Genesis West in Davenport, where she recently accepted a position. Stephanie would like to thank her family and friends for the love and support they have provided her throughout this experience in her life. Congratulations, Stephanie. Rachel Holland. Rachel's mother, Virginia Holland, will be pinning her. Rachel's areas of interest is cardiology, cardiovascular, and cardiothoracic surgery and critical care. Her future plans include job hunting and moving with her boyfriend to Rockford or the Madison area. Rachel would like to thank her parents, her boyfriend, and her sisters for their love and support. She also has a big thank you to all of her nursing professors at UD, along with her preceptor, Jeannie Duggan. Congratulations, Rachel. Rebecca Horton. Rebecca's mother, Linda Horton, will be pinning her. Rebecca's areas of nursing interests are critical care and women's and children's health. Her future plans are to eventually work as a critical care unit, such as a general ICU or neonatal ICU. She would like to thank her family and fiancé for all their support and encouragement. Congratulations, Rebecca. Melissa Kindred. Pinning Melissa is her parents, Herb and Lynn Miller, and her husband, Charles Kindred. Melissa's areas of interest are women's health and wellness with a special interest in oncology and holistic nursing. Her future plans are to start work at Mercy Medical Center in Dubuque, where she was recently accepted a position on 4 West. She also plans to assist with the Iowa Mind-Body Institute to help people thrive during and beyond with their battles with cancer, and she also plans to attend grad school in the spring. She would like to thank her parents, husband, and family, as well as the nursing department for their continued encouragement, love, and support. Congratulations, Melissa. Samantha Miners. Samantha will be penned by Richard Scaife, her boyfriend. Samantha's areas of interest are intensive care and acute care. Her future plans are to pursue her dream of becoming a nurse anesthetist. Samantha would like to thank her parents and sisters for giving her the support to push forward, her loving boyfriend, her nursing girls for making sure that she never gave up, and the faculty and her preceptor, Courtney, for sharing their knowledge and experience. Congratulations, Samantha. Laura Menta. Laura's parents, Ed and Bev Menta, will be penning her. Laura's areas of interest are OB, pediatrics, or emergency nursing. Her future plans are to return to Grays Lake and eventually go back to school to pursue a doctorate in nursing to become a nurse practitioner. Laura would like to thank her family, boyfriend, roommates, bookstore workers, and preceptor for all the love and support over the years. Congratulations, Laura. Katie Mueller. Katie's fiance Scott Schnaring will be penning her. Katie's areas of nursing interest is OB with a special interest in labor and delivery. Her future plans are to work full-time in labor and delivery at Mercy Medical Center here in Dubuque, where she recently accepted a position. Katie would like to thank her family, Scott, and her classmates who made the challenge of nursing school both enjoyable and a time in her life she will never forget. Congratulations, Katie. Abby Owens. Abby's mother, Becky Gallagher, and Jim Owens, her father, will be penning her. Abby's area of nursing interest is pediatric oncology. Her future plans are to start working at University of Iowa Hospital and Clinics on the adult leukemia and transplant unit, where she recently accepted a position. Abby would like to thank her family and Chris for their support. Congratulations, Abby. Carly Runk. Carly's parents, Pam and Ron Runk, will be penning her. Carly's areas of interest are critical care and medical surgical nursing. Her future plans are to work in a hospital in either critical care or in med surg. Carly would like to thank her mom, dad, and brother Parker for their support, boyfriend Ian for all the help and the late night studying. The love and support from everyone means the world. Congratulations, Carly. Spencer Smith. Spencer's parents, Monty and Jenny Smith, will be penning her. Spencer's areas of nursing interest is oncology nursing. Her future plans are to work on 4 West Surgical Services at Mercy Health Center here in Dubuque, where she recently accepted a position. She also plans to go back to school and pursue a doctorate in nursing. Spencer would like to thank her family and friends for being supportive the past 4 years. You guys are the best. Congratulations, Spencer. Shanna Spees. Shanna is being penned by her mother, Lori Spees. Shanna's area of nursing interests are undecided at this time. Her future plans are to work in the Quad Cities area. Shanna would like to thank her parents for their love and support. Congratulations, Shanna. Brittany Stamba. Brittany's husband, Ryan Dirks, will be pinning her. Brittany's areas of interest are emergency nursing, trauma, and pediatrics. Her future plans are to work in an emergency department and go back to school to obtain a DNP as a family nurse practitioner specializing in diabetes management. Brittany would like to thank her husband, Ryan, parents Chris and Linda, her siblings Grace and Jordan, grandparents, family, and other friends for their continuous support, love, and encouragement. Congratulations, Brittany. Ashley Sullivan. Ashley's mother, Sue Sullivan, and her son, Braxton Nodoff, will be pinning her. Oh. Ashley's areas of interest is med-surg nursing. Her future plans are to begin working on the 3 West Medical Unit at Mercy Medical Center here in Dubuque, where she recently accepted a position. Ashley would like to thank her family and friends for helping her through the last 5 years. Congratulations, Ashley. Stephanie Ann Swearingen. Stephanie is being penned by her parents, Corinne and Rick Swearingen. Stephanie's areas of interest are intensive care, and she is extremely interested in anesthesia, and she has a love of the heart. Her future plans are to work in an ICU, obtain her CCRN certification, and attend CRNA school. She hopes to work where it is warm, and it is also a magnet hospital. Stephanie would like to thank her parents for their ongoing support, family and siblings for their encouragement, Travis for keeping her grounded, and Lucinda for her inspiration. Congratulations, Stephanie. Rachel Tilkins. Rachel's parents, Rosa and Ray Tilkins, and her fiance, Sky Korch, will be pinning her. Rachel's areas of interest are pediatrics and OB labor and delivery. Her future plans are to find a position at one of the hospitals in the Quad City area, either in pediatrics or labor and delivery. She would like to thank her family, friends, and fiance for their encouragement and support, preceptor and professors for their time and expertise. Congratulations, Rachel. Chelsea Vormasale. Okay. Pinning Chelsea is her fiance, Trevor Runkle, Linda Hewitt, and Joe. Chelsea's areas of interest is pediatric oncology. Her future plans are to begin work in the Genesis Health System in oncology, where she recently accepted a position. Chelsea would like to thank her parents, Trevor, Mary, Larry, and the rest of her family, along with her best friend Courtney, for being her support system these last 4 years. Congratulations, Chelsea. Christy Woods. Christy is being pinned by her sister, Michelle Heim, and her daughter, Alexis Allen Price. Christy's areas of interest are mental health, home health, hospice, and geriatrics. Her future plans are to become a nurse manager and then obtain a master's and eventually a teaching position. Christy would like to thank her parents for their eternal support and the rest of her family, her husband, and her children for their inspiration. Congratulations, Christy.
Well done. Okay, we're almost done. At this time, though, I'd like to acknowledge the nursing faculty, some of whom you've already met today, but I'm going to introduce them all. And as I say your name, please stand and come up here and gather around me. Also, a special thank you to Dr. Reed. You're coming up too, okay? So please join me in thanking them. Professor Pam DeMoss, Professor Peggy Brandon, Christy Steinbeck, Professor Lisa Kragenbrink, Professor Beth Nyan, and Dr. Neil McNaughton. And Dr. Barbara Reed. Reverend Dr. Barbara Reed will be bestowing a blessing on our graduates before we let you out and send you out to the world. Also, Miss Brittany Stombaugh from the class of 2014, who again was selected by her classmates to write and offer a prayer for the class. We'll be doing that now.
All right, please join me in prayer. Dear Heavenly Father, thank you for bringing us together today to celebrate our pinning ceremony. We are so grateful for the many blessings you have given us, and thank you for the great privilege of attending a school whose values are rooted in the Christian tradition in this great country where we can worship you freely. Father, we also thank you for calling us to be nurses. It is no accident that we are here, Lord, as it says in Jeremiah 29:11, "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you a hope and a future." We are so blessed to enter this profession, and you have been preparing our hearts for the journey ahead in this career while we are here. You have enriched our lives with these wonderful classmates to fellowship with during long hours of studying and busy days at clinical. Passionate professors who have taught us about the art and science of nursing, and our friends and families who encourage us and love on us when we are weary after a 12-hour shift. You have provided us with dedicated preceptors who have shown us new skills, and patients who have renewed our faith in this profession, whose smile and gratitude make the long hours worth it. You have allowed us to see new life enter the world, and also a patient take their last breath. We are humbled by these experiences, Lord. Father, we petition that you pour in us compassion when it is running low. Give us joy and laughter to lift a weary soul. Grant us strength and wisdom and courageous leadership, energy and patience to make it through all hours of our shift. Give us time to comfort patients in our care. Let us be a light and example of you, Lord. This is our humble prayer. Father, you have begun a good work in us, and your word promises you will never fail us. There are many trials ahead, but we know we are not alone. For we know that God causes all things to work together for the good of those who love him and who are called according to his purpose. Romans 8:28. Thank you for your unfailing love. Enable us, equip us, and let us be good stewards of the gifts you have given us. In your name we pray. Amen.
From the words of Mother Teresa. People are often unreasonable, irrational, and self-centered. Forgive them anyway. If you are kind, people may accuse you of selfish, ulterior motives. Be kind anyway. If you are successful, you will win some unfaithful friends and some genuine enemies. Succeed anyway. If you are honest and sincere, people may deceive you. Be honest and sincere anyway. What you spend years creating, others could destroy overnight. Create anyway. If you find serenity and happiness, some may be jealous. Be happy anyway. The good you do today will often be forgotten. Do good anyway. Give the best you have, and it will never be enough. Give your best anyway. In the final analysis, it is between you and God. It was never between you and them anyway.
Okay, the pinning ritual is almost done, but there's one more thing. Would all the graduates please stand? And now turn around so your friends and family can see you. On behalf of the University of Dubuque and the nursing faculty, it is with great pleasure and pride that we present to you the University of Dubuque class of 2014 nurses. Congratulations. I'd like to thank you all for attending today. Everybody's invited to stay for the reception, offer congratulations, meet faculty, and greet students. Thank you so much.